alaikum. Guys, today I am recording this metabolic syndrome from the talk article. So, what is the metabolic syndrome? It includes central obesity, hypertension, insulin resistance, atherogenic dyslipidemia. Metabolic syndrome occurs in 1 in 3 women with PCO, and PCO affects 10 to 18% of the women of the reproductive age. Metabolic syndrome is associated with the long-term health consequences like cardiovascular disease, psychological problems, sleep apnea, cancers, and type 2 diabetes. How we screen and diagnose this metabolic syndrome? This condition places a large burden on the healthcare services, meaning accurate identification and timely intervention are very important. So, how we screen and diagnose? We have to take the history of smoking. When at every visit, obtain history of recent smoking habit, if any, or cessation since how long and how many cigarettes per day. Blood pressure screening annually for a female whose BMI is less than 25, or at every visit for a woman whose BMI is more than 25. The diagnostic cutoff of systolic blood pressure is more than 130 millimeter of mercury, or diastolic blood pressure is more than 85 millimeter of mercury, receiving treatment for existing hypertension. Screening for the obesity at every visit. The diagnostic cutoff is waist circumference is more than 80 to 88 centimeter. For diagnosis of the diabetes, oral glucose tolerance test when it was done every 2 years or annually in the presence of risk factors like age, smoking, BMI. The diagnostic cutoff elevated fasting blood glucose level more than 100 to 110 milligram per deciliter or receiving drug treatment. Complete lipid profile screening should be done every 2 years for normal profile annually, every 2 years for normal profile, annually for abnormal profile or excess weight gain. The diagnostic cutoff is raised triglyceride levels more than 150 milligram per deciliter, reduced high density lipoprotein C levels less than 50 milligram per deciliter or receiving drug treatment. What's the management? The main management is the lifestyle modification. This is the only recommended intervention at present. The lifestyle modification is reduction of the weight by exercise and diet modification. Exercise reduces the insulin resistance and optimize the lipid profile. The aim to lose 5 to 10% of the body weight in the first year after diagnosis. So 150 minutes of exercise per week or 90 minutes of moderate intensity should be done. Optimize equal diet, optimize the quality, quantity, and spacing. It means you have to take in a frequent intervals. The small portions at frequent intervals you have to take from all essential dietary products like fat, protein, carbohydrate, fibers. So fat 40 to 50 gram per day is the recommended. Protein 100 to 110 gram per day is recommended. Carbohydrate 250 gram per day and fiber 25 to 30 grams per day should be taken. Medications, insulin sensitizing agents such as metformin and inositol, anti-obesity agents such as Orsilate. They are available in different formulations, stated to improve the lipid profile in women with dyslipidemia. The surgical treatment for the woman with a BMI of more than 40, she should offer bariatric surgery. For women with a BMI of 35 to 39.9 and having associated conditions, comorbidities like diabetes and hypertension, bariatric surgery should be advised. The procedure include laparoscopic adjustable gastric banding, vertical banded gastroplasty, and ROICs and gastric bypass. Further research is needed before surgery can form the part of mainstream management of metabolic syndrome in women with PCO.